Welcome to Hey Dr. Sue. So people submit their sex questions to me anonymously, and once a week I post one question and one answer. Do you have a sex question you've always wanted answered? Go ahead and check out the description for information on how to submit it anonymously. This week's question is, I know you already have a similar question on your YouTube channel, but I wanted to ask anyway, just to be sure. In a relationship where only mutual masturbation takes place, if semen from indirect transfer via fingers comes into contact with the vaginal canal, how high is the risk of pregnancy? So honestly, the chances of semen transferring live sperm from fingers to the vaginal canal has a relatively low risk of pregnancy. I can't give you an exact number, but it's definitely on the lower side. But keep in mind that low is not zero. If there has been contact between semen and the vagina and you're worried about the chances of pregnancy, then emergency contraception is an option. Two things to note. The first is that emergency contraception can be used up to 5 days after unprotected intercourse, though the sooner you use it after, the more effective it is. The second is that unlike what many people think, emergency contraception is not the abortion pill. If you want to understand the difference between them or just ask a general question about emergency contraception or the abortion pill, please feel free to ask. The link for submitting a question can be found in the video description. The other thing to keep in mind about emergency contraception is that it's a lot of hormones, like a lot of hormones, and that can be really disruptive of the menstrual cycle. Some people don't like that, and some people just don't like taking hormones. The good news is that the cost has come down in a lot of places, so it may not be as pricey as it used to be. If you can't find it locally or just don't want anyone locally knowing that you're buying it, you may want to order it online, though this may not be the best option if someone needs to take it right now. If you're engaging in vaginal play or vaginal intercourse and no one is using a hormonal method of birth control, it can be a good idea to just have some on hand just in case. That way you don't have to first figure out how to get it if there is unprotected intercourse. Most emergency contraception has a shelf life of like 3 to 4 years, though definitely check the expiration date on any emergency contraception you have. But again, in the situation that you described, the risk of pregnancy is relatively low. I know your question focused on pregnancy, but my concern is also about STI risk. If there was semen on the hand or a sex toy, there can be STI transmission, though again, there is a lower risk than there is with intercourse. If you and your partner haven't already had a conversation with each other about STI history, STI risk, you might want to do so. And be aware of any changes in and around your genitals. If it hurts when you pee or there's discharge or blood, I would definitely suggest getting it checked out. But keep in mind that often an STI won't lead to a noticeable symptom, so something could have been transmitted even if there is no blood, pain, or discharge. To avoid a lot of concern next time, you should definitely talk to your partner about what steps need to be taken to make sure that there's no accidental semen to vagina contact. This includes making sure that any hand or sex toy that comes into contact with semen is washed before it comes into contact with the vagina. The less worried about it that the both of you are, the more you'll both enjoy the sex play. Until next time, be safe and have fun. Did you like that video? If so, make sure to like and subscribe to the channel. That way you'll know when new videos come out. Also check out the description to find out how to find me on Instagram, Medium, and Threads. And make sure to check the description for links where you can submit your own sex question.